Hello everyone. I did my interview speech on the nurse practitioner at our work, Pandora Bonstack. The most interesting thing she shared with me in the interview was her daily task. When you see her perform them tasks daily, it doesn't seem like a lot. But once you ask them to write everything down, it gets to be a lot. When I asked her what her daily tasks and responsibilities were, she stated to provide patient care, to listen to their concerns and problems, and come up with a treatment plan after she diagnoses them. She also has to read and interpret the labs and test results that come with the treatment and come up with a treatment plan. She renews all patients' medications and also answers all their phone messages that come in throughout the day. She writes referrals to other providers, such as specialists and outside facilities. A typical day for Dory is usually she arrives to the office about 8:30. She starts patient care at 9. She works until noon and has lunch from noon to 1, typically with a drug rep. And then back to patient care from 1 to 5. She usually leaves the office around 5:15, 6 o'clock after all patient messages are answered. When asking her what was the most important class or experience to help prepare for her position, she stated she was an RN for 17 years prior to becoming an NP. This gave her vast amounts of experience. She was also a medical surgical nurse, and this gave her the hands-on experience. She also was a charge nurse and a clinical instructor for students. She still currently instructs students as a nurse practitioner now and lets them experience what they will be dealing with when they are out of school. When asking her where she sees herself within the next 5 to 10 years, Dory states that she will continue her career in family practice treating patients. When I asked her advice that she would have for achieving career goals in the field, she stated to continue with school. Keep going with your education. The more, the better. She also stated that this is a growing career field. The rate of family doctors is declining, and the rate of patient population continues to increase. More NPs are needed to keep up with the population growth and help with the providing care. When asking Dory what she liked most about her job, she stated she likes to help people. She finds enjoyment in helping others and their problems and providing care to them. She likes solving their issues and giving them someone to talk to about their problems. Her least favorite, she stated it's a very stressful environment. Not environment, it's very stressful. She said it's hard listening to people's problems all day. It can be emotionally draining. She also has a fear of missing something, such as cancer. The paperwork can also be very time consuming. Patients bring in FMLA paperwork that's usually like 5 to 10 pages. They also have things for insurance that need to be filled out, which also take a good 20 to 30 minutes to fill out. Some of them are very time consuming and request a lot of information. When I asked how does she deal with difficult parts of her job, she stated she talks to the physician in the office to get her advice. She also talks to coworkers who typically know the patients more than she does. I try to add humor to the situations when I can. When asking how did she get interested in this field, she states many of her family members are in the healthcare field. She has grown up around it. Her mom was a nurse. Her older sister is actually a PA. She has a sister-in-law that is also an RN. And then she was an RN for 17 years, as I said before, and now she's a nurse practitioner. So she states she was also very interested in the body and disease process. When I asked her, is there much opportunity for advancement or promotions, she stated no chance at advancement in the current office she's in. She is the only position of an NP. She could go back to school to get her PhD in nursing, but it would not advance her career in the office. Most important skills for her job is listening, paying attention to what someone says, and reading their facial cues. The ability to interpret test results and knowledge as to what to do with the results. Another important skill, being able to talk to someone and give them the correct information in such a way that they can understand. What sort of personality or characteristics are best suited for her job? She states being friendly, the ability to talk, good communication skills, ability to listen. What are related job opportunities when you become a nurse practitioner? The ability to teach classes to nursing students. She could specialize in a practice or work in an urgent care or hospital setting. This degree opens many doors for her. And lastly, I asked her what was the average range of salary. She stated the average range in this area is $60,000 and up. Hospitals and specialties pay more. On-call and hospital rounding nurse practitioners also pay more. I was amazed by the amount of money that they could make.